Hello and welcome to Season 2, Episode 24 of the Physician Assistant Exam Review Podcast. This week we're going to be covering the dreaded topic of heart block. My name is Brian Wallace. I'm the host and creator here at physicianassistantexamreview.com, and here at the podcast over on the website you can find all of the show notes. Like I've said in the past, I know lots of people like to head over there and listen to the show while they are going through the notes. I think that's a good visual and audio way to do it. We've always talked about how more than one sense helps a lot with retention. I've been talking a lot in the email group about different ways of helping retention. Some fatal mistakes people are making in just sort of shooting themselves in the foot, trying to remember more and more things and doing a less and less good job of it. So we've been going back and forth quite a bit over there with some discussion on that. If you have not checked out the email list, certainly please go over to the website and jump on. Hang on just one second. And okay, I'm back. What I wanted to just set up was a while ago I had gone through and set up a system where you could opt into the email list right from your phone by just sending a text message, and then it would take care of the whole thing for you. The system sort of fell apart in the back end, and I kind of gave up on it. But recently they updated some things and made it a little bit easier to work with. So if you're interested in signing up for the email list, getting the daily tips, tricks, and just a ton of information on helping you get through the material, test questions, pretty much everything and anything I can think of to help you, that goes out every single day. How you would do that is simply send a text to the number 33444. Again, that's 33444. And what you're going to send is PA exam, all one word, PAEXAM, all one word. Then it's just going to bounce you a quick message asking for your email address. You text that back in. And along with that, I set it up so that you'll get the free preview copy of the final step. It's basically the cardiology chapter of the whole book. So you can go ahead and grab that just by texting the number texting to the number 33444, one word, PA exam, PAEXAM. All right, so go ahead and give that a shot. If for some reason, I just set it up in the last couple of minutes, if for some reason that kicks you out, doesn't get you your copy of the preview copy there, just let me know and shoot me an email. We'll fix it and take care of it. No problem if there's any kind of issue with the technical aspects. So where was I? Let's see. So this week we're going to be covering something that's always been difficult for me, heart blocks. We've been covering arrhythmias, we've been covering myocardial infarctions, we've been covering all sorts of cardiology stuff. This week we're only going to be doing heart blocks because I just think it's that important for your brain to function, to think just about this one topic at a time. And I think it would be the best way to handle it, really. It's always been something I've had trouble wrapping my head around, so I want to make sure we're very clear and you leave today with a nice picture in your head of what these are and sort of the background for why they work, not just memorizing everything, but actually getting a clear picture, a clear understanding for it. So let's start off today with some priming questions. What are two things you need to know when given a patient with an arrhythmia to treat? So like in a test question, they give you an arrhythmia. What are some things you need to know about the patient besides just what the rhythm strip says if you're going to treat them? Are they stable? And do they have a pulse? Obviously, those are going to change the way that you treat things. If they're unstable versus if they're stable, and if they are pulseless versus they have a pulse. The heart rhythm that is irregularly irregular, which one is that? Which rhythm is described as irregularly irregular? The answer there, of course, is AFib. I know you're very proud of yourself because you got that one right. Let's move on just a little bit and say, if you knew that, take a minute and out loud explain why it's irregularly irregular. Why is it irregularly irregular? What does that mean? All right, well, it means that the rate is all over the place. The different parts of the atria are firing all different at different times. So you don't get just the SA node or the AV node or one part of the heart firing. It's basically all of the different parts of the heart firing whenever they feel like it. So it's completely irregular and it's all over the map. Number 3 for today. This is one from a ways back. When does Dressler syndrome typically occur? When does Dressler syndrome typically occur? One to 2 weeks after a heart attack. And if you don't remember, check back to episode number 20, and when we go through all about Dressler syndrome there and heart attacks. All right, so let's jump into heart blocks for today. So we start off with atrioventricular block, AV block. AV block is when there is a problem conducting the signal from the SA node through the AV node to the ventricles. All right, so this needs to make sense. SA node fires. The signal goes through the atria down to the AV node. Something happens in the AV node that causes that signal to either be slowed down or not get through to the ventricles. This is AV block. Now, there's several kinds of AV block, right? And that's where things start to get a little bit painful. First degree AV block is the signals come from the SA node are delayed through the AV node, so it's slowed down. First degree AV block, things are just slowed down. You get a PR interval that's greater than 0.20 seconds, so that's more than one box on an ECG strip, but all the signals get through. That needs to be super clear. First degree AV block, all the signals get through from the SA node down to the ventricles. They get through the AV node. They're just slowed down, and they're consistently slowed down. So let's think about that for a second. Let's say a person had a heart attack. And if you remember, a heart attack just means that some of the tissue of the heart died. So now you've got scar tissue. Well, let's pretend for a second that the AV node has a little bit of scar tissue through it that conducts electricity just a little bit slower. It'll still conduct electricity, but it's got a little higher, I can't think of the term for it, but it's a little slower. Let's just make it easy, a little slower. So the signal gets through, but just not at the same speed it normally would. So the PR interval, the time from the atria contracting to the ventricles contracting, is extended, greater than one box on the ECG, but all signals get through. Second degree AV block means some of the signals from the SA node may be delayed through the AV node, and some of the signals from the SA node never reach the ventricles. So think about that for a second. What does that mean? Subsignals from the SA node may be delayed through the AV node. So that sounds a lot like first degree block, right? So we get this situation where all the signals are getting through, but they're delayed. And then the second part of that, though, is some signals don't get through, right? So some signals get sent from the SA node, they get sent down, and the AV node just takes them and does nothing with them. It does not pass them along. There are two types of second degree, and that's where, again, things just get a little bit more confusing. This is not hard, but whenever we branch out like this and create a bigger outline, it just becomes a pain in the butt. But again, this is something I find very easy to write test questions on, something I think you should know just because I don't think it takes that long. I don't think it's that hard. If you put a little concentration into it, you'll get this right on your exam. If you see it, you'll be thrilled to see it. Second degree type 1, second degree type 2. Also known as Mobitz type 1 and Mobitz type 2. And unfortunately, second degree type 1, also known as Mobitz type 1, can also be called Wenckebach, right? So now we've got three names for one thing to make it just a little more confusing. So what Mobitz type 1, second degree type 1, or Wenckebach, what they mean is you get a longer and longer PR interval until one signal is dropped. So let me try that again. The PR interval, so the time it takes for the signal to pass through the AV node, gets progressively longer with each beat until one beat just doesn't get through, one signal doesn't get through, and then the pattern resets. So let's pretend that the first beat, the PR interval is 0.2 seconds. The second beat, it's 0.4 seconds. The third beat, it's 0.6 seconds. And on the fourth beat, there is no QRS. And then it picks up again with a PR interval of 0.2, 0.4, 0.6, dropped beat. 0.2, 0.4, 0.6, dropped beat. Now, we get back to my question earlier about AFib and the question of irregularly irregular. Here, Mobitz type 1, Wenckebach, and second degree type 1 are all irregular, right? You don't get a regular beat here. A regular beat is a beat every on a certain interval. If the PR interval is lengthening, then the amount of time between QRS intervals is also going to be lengthening, right? So you get an irregular rhythm because each beat goes at a different time. Each QRS isn't, I don't know, making up numbers, isn't 1 second apart, right? The first beat, let's just pretend, again, I'm just totally making up numbers here. Let's pretend the first beat, the QRS is 1 second apart, but the second beat, it would be 1.2 seconds apart, then 1.4 seconds apart, then 1.6 seconds apart. Then there'd be a dropped beat. So it might be 2 seconds between QRSs. Again, just totally making up numbers. But that's the idea. So that would be a irregular rhythm, but it's a regular rhythm, as opposed to a fib, which is irregularly irregular. And I hope you can see the difference there. One is a nice pattern that repeats. It's irregular, but it's a repeating pattern. A fib, not a repeating pattern at all. There's nothing regular whatsoever about it. So that's second degree type 1, Mobitz type 1, or Wenckebach. Again, just getting those straight in your head, all three of those are the same thing, and they simply are that longer and longer PR interval until a beat gets dropped. Second degree type 2, so this is AV block second degree type 2, also known as Mobitz 2, there's no third name associated with it that I know of, is an intermittent dropped impulse without lengthening PR intervals. So you don't get that lengthening interval. The Wenckebach, the Mobitz type 1, is the lengthening PR interval and then a dropped beat. With type 2, you just randomly get dropped beats. These can be very regular, so you can get something like a 2-to-1 AB block, which is 2 P waves for every QRS wave. So atria, contract, QRS. Atria, contract, QRS. That would be a second degree, AV second degree type 2, okay? You can get a 3-to-1 AV block. P wave, P wave, P wave, QRS. P wave, P wave, P wave, QRS. That's a 3-to-1 AV block. But you see, we're not lengthening that PR interval like we did in the first type. Now, the important thing is there's two keys here. One is recognizing these on ECG. These are pretty easy to pick out on ECG, honestly. These you should be happy to come across. To me, it was more just remembering the names that go with them, which one is which. And that's just going to be working with the final step. That'll help because that certainly has questions on it. But it's also just working on with these names and writing out some of your own questions. That would be something I would be doing that would really help put these in place, that kind of thing. But working with the names to try to solidify them. Where type 1 is that longer PR interval on a drop. Type 2 is just summer block, but no lengthening PR interval. Now, the other thing, getting back to my original thought here, I got sort of lost there, is that with second degree type 1, this may be benign. This does not have to be treated. It may be benign. Doesn't need treatment. It might need treatment. Doesn't have to. Second degree, though, is going to need a pacemaker. This is much more dangerous. Definitely needs a pacemaker. Then we move on to third degree block, or complete heart block. And in that name, it sort of makes more sense. It's much more useful than calling it something Wenckebach, which doesn't give you any information. Complete heart block, no impulse passes through the AV node to the ventricles. Pretty simple to define. No impulse passes through the AV node to the ventricles. The atria contract and the ventricles contract, right? They just don't listen to each other. They don't care about each other. They're completely asynchronous. So what happens if they're asynchronous? Well, you get the atria to contract, right? By the SA node firing. That signal does not get pushed through to the AV node. The AV node will fire, right, at a rate of 40 to 60 beats per minute. The SA node was, what did we say, about 60 to 100 beats per minute. So in this sense, since they're totally separate, you're going to wind up with the atria contracting, at least double, triple the number of times the ventricles contract. And you can see why that is not good for blood flow, why that would cause some major issues. All of the stuff you learned in physiology about that little stretch of the heart, pushing the blood in and the filling of the ventricles and how that helps to push it back out. All of those issues get screwed up with, and this is all asynchronous. This is going to require a pacemaker. This is not going to be something that you want to leave alone. This is going to require treatment. And our last one today is going to be bundle branch block. This is a little bit bigger topic I think the whole conduction system through the heart. We pretty much cover the SA node, the AV node, and then a little bit more. But there's certainly so much more in this area to know. The more I delved into it, the more interesting it got. But just trying to keep it very simple for us here, for your PANCE, for your PANRE, for your exams. Just below the AV node is the bundle of His. So basically you get this conduction system. So think about like wires running through the heart, right? So you get the SA node is like a little circuit board. There are little wires that run through the atria and send that signal down to the AV node, which again, a little circuit board. That little circuit board then sends a signal down, and the next little teeny circuit board is going to be the bundle of His just below the AV node. The conduction system branches out from there into right and left bundle branches. So think of that just like a bundle of wires coming out from those circuit boards. And these continue to branch down into millions of Purkinje fibers, which follow the muscle fibers of the ventricles to make it contract in coordination. You have to think about it as if that muscle needs to contract in a certain pattern, in a certain way. Just even the whole ventricle doesn't necessarily contract all at once. The way that the signal travels through the muscle tissue doesn't actually travel through the muscle tissue at all, which is the interesting part. It travels through these Purkinje fibers, and that allows it to move at a certain rate and speed through the heart and allows for the whole system to work in conjunction. Damage to the system will cause the impulse to be propagated through the muscle tissue, which is slower and less efficient. So you can get a widening QRS, which is greater than 120 milliseconds, if there's damage to these Purkinje fibers, if there's damage to these bundles, to the left or right bundles. And what happens is the signal, let's just say that wire gets cut. So you have a MI and that tissue dies. Well, the signal gets propagated right up to the point where there's no more functional tissue. And that doesn't just stop. It finds the next best way to travel, which is through the heart, the muscle tissue itself, and it travels along through the muscle tissue. Well, that will work. It'll get the job done, but it's not as efficient. It doesn't move as nicely through that. The signal doesn't propagate through the muscle tissue as well. So then you don't get that nice synchronous contraction throughout all of the cardiac tissue. You can picture that if you had one section of the heart contracting and the other side of the ventricle just a little bit behind it, you wouldn't get as strong a contraction. The heart wouldn't beat as well. It wouldn't push out blood in the same way. So that's what basically a bundle branch block is in concept. Again, I'm not covering ECGs here in great detail. You have to go pull those up, take a look at them. If you just Google right or left bundle branch block ECGs, should be very easy to pick out, very easy to find. But you're looking for that wide QRS, greater than 120 milliseconds will help to determine that. And here a pacemaker is not always going to be necessary, but definitely your treatment choice. Your treatment option that you're going to be looking for is going to be pacemaker. All right, that covers heart blocks. Again, this is just something I feel like people trip up on just based on terminology, really just based on Mobitz type 1, Mobitz type 2. If you can get those words right, that's half the battle as far as heart block goes. I don't think it's a terrible, difficult topic. It's just something to memorize and something to help try to keep straight. So before we get to our closing questions for today, let's talk a little bit about our study tip for today. This is something else that I've been covering through the email list throughout this week. The idea, something that I push hard, and people always ask me for advice. What should I do? One of the times I get this question is right before their exam. People like to reach out to me about a week or a couple of days before the exam and say, "Geez, is there anything else you can give me? I'm starting to freak out. I really need some help." And the advice I give to them, and the advice I give most commonly for everyone, is to be sure that you take the day before the test off. Don't go to work. Don't sit in traffic. Don't do anything that's stressful. Do anything that's painful for you. You need all of the brain power you have. You're going to need all of that when you take the exam. So personally, I think taking the exam on a Friday or a Friday or a Saturday makes the most sense. Then you take the day before that off. At my work, fortunately, they give me the day for the exam off as a, what do they call it? I guess it goes into my CME and training days, which is great. And then I just use a vacation day for the day before. But I think it's so absolutely worth it. You're talking about one day every, 5, 6, now 10 years. Take the day before your exam off and don't study. Don't put any time into your test. I think studying the day before your test is such a total waste of time and such a detriment to what you're going to do on your exam. If you're a PA student, you've been studying for 3 years. 3 years. I'm going to say it again, 3 years. One more day isn't going to make you pass or fail this thing. Not with the information you're going to get. It can wear you out and make your brain not work real well, so that way you don't function as well as you might be able to. If you're taking your PANRE, you've likely, if you follow my advice, been studying for 2-3 months. Again, 3 months, 90 days. Taking one day off isn't going to make or break you as far as the information in your head. You're either going to know it or you're not at that point. That's at least my feeling. And what is going to make or break you is the ability for your brain to perform at its peak, at its best. You're going to need to be making connections between seemingly completely different material. You're going to have to be pulling information out of your brain that you haven't thought about in a long time. You need to be functioning at your absolute prime, and there's no way that if you spend the day before studying, you're going to be at your tip-top best shape. I have people who email me and say, I listened to your show on the way into my exam, and I say, you're out of your mind. Don't do that. I'm very flattered, but please don't listen to the show on the way in. I have very specific music I listen to before an exam. I probably listen to the same song 10, 15 times before every exam in PA school, and I do the same thing now. I think I've talked about this before. It's a Radiohead song. Give me just a second. I'll look it up here. It's here it is. I can't believe I couldn't think of it. It's called Everything in Its Right Place. I also think OK Computer is a great album from them for just clearing out your head before a test. Like I said, I would listen to those albums a couple times the day of my exam, the morning of my exam, or driving into my exam. Absolutely not studying. Not trying to think about any material, trusting my brain that I'd done the work, put in the time, and my brain would function and do the thing it's supposed to do and help me pass this test and not push it over the top and wear it out by trying to memorize more things the day of the exam. Again, what am I going to remember? One thing out of 300 questions? Who cares? It's just not worth it. I think you're going to get 15, 20, maybe 30 questions right, trusting your brain, using it to answer the questions. Now, something I want to fill in here, and the reason I was writing this out to everybody this week was I push this information all the time, but I also think it's probably the most ignored piece of advice that I have as well. I think most people probably hear it and say, that's dumb, I can't do that. And it's, again, because you've been studying for 3 years or 3 months or whatever it is, it's been a long time. You've studied a lot. So you're hard to turn it off and say, well, I'm just not going to do anything this day. And my answer is, I'm not saying don't do anything. I think that's also not helpful. You're just not going to be able to do that. So I put together a list of 60 different things you could do the day before your exam, and I sent that out to my list. And I think doing something is really, really helpful. I think you need to be doing something. I'm not saying you do nothing. What I'm saying is you do things. They're just not studying. They're just not things that are stressful. They're not things that wear on you, that use up brain power. There are things that refresh you, that rejuvenate you. And those things tend to be things like being outside, accomplishing an easy task. Like, let me give a different example. One I didn't even share with that in that list was today, before I did this podcast, I was out on my deck scrubbing my chairs. And at first I was listening to a different podcast, and then I just turned that off. And it was so beautiful out. I think it's about 68 degrees. The sun was out. The wind had stopped. And I have these teak patio furniture. And it just got filthy. I didn't, like a moron, I didn't cover it over the winter. So it's just really gross. And so I spent about half an hour just scrubbing this one chair. And it came out really nice. It looks great. And I felt so much better when I was done. But it didn't take any mental capacity. Didn't take any thought. Didn't take any stress. It was so rejuvenating in that sense. And that's what I'm talking about. Find a little project. Find something small, something easy but physical. Plant some flowers, go for a walk, things of that nature. Things, if you can accomplish something, that helps. That makes your brain feel even better. Those endorphins that get released go a long way to make you feel better when you accomplish something. But again, nothing that's going to be stressful. I'm not talking about repainting your kitchen. Nothing hard. These should all be really simple, easy tasks. But the key here is, and the thing I really pushed is, take some planning. You can't just say, I'm going to take the day off and then expect yourself to be able to turn it off. You can't. when you make your study plan, you need to put this day in the calendar, and then you need to write down the things you're going to be doing. If it's the middle of winter, planting a garden that day is probably not going to be what's going to work for you. Think it through, pick some activities that'll help you, and schedule them. All right, so let's finish this up with some questions relating back to, well, let's just do some heart block questions and see how we do. Was it first or second degree heart block that required a pacemaker? First or second degree heart block that required a pacemaker? The answer is second degree. What PR interval defines first degree AV block? What PR interval defines first degree AV block? 0.2 seconds. Well, greater than 0.2 seconds. First degree or second degree? Which one has lengthening PR intervals? Which one has lengthening PR intervals? Second degree type 1, Mobitz type 1, Wanky-Bach. All the same thing. They've got that lengthening PR interval. All right, and a couple things just before I sign off for today. I wanted to congratulate Maria on her passing her exam from MCPHS. She just sent me an email saying that she did finally pass her exam. I don't mean finally, like she's taken 100 times. I mean that she was a PA student who I've known for some time and communicating with for some time, and she just emailed me to say that she'd passed. I'm so happy she shared that with me. I'm so excited for her. This is going to be awesome for her moving forward. So much to do, and just getting out there and practicing. So I'm thrilled for Maria. I also heard from Leroy a couple of days ago saying he had passed his exam. So congratulations to you. Congratulations to everybody who passed their tests. All the class at MCPHS who I got to know. I'm sure I haven't heard from each of you individually, but I'm sure most of you, if not all of you, have passed your exams now. So congratulations. Maybe you're not even listening anymore. That's even better. So congratulations to all of you. Thrilled about that news. Oh, before we sign off for today, again, just wanted to remind you, I did set up that, where is it? Here it is. The phone number. So if you want to just text in to 33444, that's the number you text to. And you text PA exam, all one word, PAEXAM. That'll get you on the email list, get you signed up for all the daily study tips. There's some amazing stuff that comes through there initially, and then I'm in touch with you very frequently, sharing as much information as I possibly can. And you will also get the Final Step Preview Edition delivered directly to your email. And again, I just finished setting up, so if something goes wrong, something doesn't work there, just shoot me an email and I'll make sure that you get it. It's easy, no big deal. But hopefully everything works the way I set it up. It rarely does, but hopefully this time, maybe who knows? Maybe you get lucky. All right, well, take care. Thank you so much. Next week, what are we going to be doing? We're still going to be that's the wrong list. We are still going to be covering cardiology. I don't have in front of me exactly what, so we will find out together next time on the next show. All right, take care. Good luck.